Okay, this week you're going to be doing PCR, which involves working with some pretty small volumes. You'll be pipetting a lot of things at 2.5 microliters. And our PCRs have a pretty high failure rate. About 50% of our students don't get a successful PCR product. So I'm going to try and help out. I think a lot of the problems come with working with those small volumes. So when you work with these small volumes, you want to be really careful because it's very easy to lose some liquid to this sticking to the outside of your pipette tip or sticking to the tube. It's also easy to just kind of miss pipette and not do it quite properly, and that can really ruin your PCR reaction. So first thing, when you're working with small volumes, right, you want to be mindful when you're pipetting. So don't stick your tip all the way in to draw your liquid. That's not necessary, and you're coating the outside of your tip with a lot of this liquid. So instead of adding 2.5, you might actually be adding 4 because of all the liquid on the outside of your tip now. So when you're getting your volume, just go a little bit beneath the surface of your liquid, pull up your volume, okay? And then when you're adding it to the tube, similarly, you don't want to go dip your tip in all the way and pull out a bunch of liquid. You want to just add it to the top of the liquid surface or just below. You don't want to add it to the side of the tube because then when that droplet has to go down the side of the tube to get to the liquid, you're losing volume again there, and it's not quite as accurate. Okay, so be mindful in the accuracy of your pipetting with small volumes. Also, the way that you mix is very important. So you're not going to want to vortex to mix, right? When you vortex, the liquid goes all around the side of the tube. So if I had a small volume, I've now probably have most of my liquid really coating the sides of my tube and not down at the bottom where I want my reaction to occur. So instead, to mix, you're mostly going to be pipetting up and down. When you pipette up and down, the real trick is that you never go to the second stop, okay? And you want your pipette set to a reasonable volume given the volume of the liquid you're mixing. So if you have 50 microliters total, you might want to pipette up and down with your pipette set to 10 microliters, okay, about 20% of your overall volume. The reason is if it's set too high, then when you pipette up and down, you might pull out all your liquid and start to pull out some air and make air bubbles in your reaction, which can be bad. If it's too small, then when you pipette up and down, you're really not mixing your liquid up too well. So pipette up and down, set to a reasonable volume, and do it a lot, maybe 30 times. So beyond where you feel like it's mixed, go about 10 more times. All right, another important thing when working with small volumes and doing PCR reactions is the order that you add your components is important. So it's always best when working with small volumes to add the largest volume to your empty tube first, and then you have a liquid to add the smaller volumes to, which is easier than putting a small volume in an empty tube. So with our PCR reactions, your largest volume will most likely be water. So you'll add your water first, and then you also, after that, you'd want to add buffer. That way your reaction is at a good pH, so it's stable when you add all of the other components, which might be more sensitive to pH levels and whatnot. So water and buffer first, and then you'll add like your primers and DNTPs, and then last you always add the enzyme because it's pretty sensitive, and once the enzyme's in there, it can start trying to catalyze your reactions, which you don't really want to start until all the other components are in your reaction tube. All right, so water and buffer first, enzyme last. Also, you'll want to assemble your reactions on ice. The DNTPs in particular are sensitive to temperature, so they can hydrolyze and lose that triphosphate bond if they're at too high of a temperature. So keep your reactions on ice until you put them in the PCR machine. After your PCR, right, you'll have a small volume of your PCR reaction, and you will probably want to spin it in the mini centrifuge on your bench at your stations to collect all that liquid in the bottom before you try to remove any of that liquid and do anything with it. So if you ever, in working, don't have all your liquid collected at the bottom, do a quick centrifuge. And when I say quick, I mean like 1 second on and off, right? Just move that bottom to the bottom of the tube. The other really important thing for these reactions, you'll be working with many tubes with your lab group. There's about 500 students. We're going to have tons and tons of small tubes that are difficult to label. So it's really important that you be very organized that you know where your tubes are, where they're going to be stored, what order they're in, and you label them as well as you possibly can, and keep notes in your lab notebook about those labels. Because the tubes are so small, you might only be able to label them 1, 2, 3, 4, 5, etc. So in your notebook, you want to be sure you know what tube 2 has in it exactly. And you always want to label the top and the side of tubes going into a PCR machine, because quite often at the end of the reaction, the top of the tube the label will be smeared off or gone because it gets pretty hot and steamy in there. All right, so just be very mindful, and hopefully we can beat our 50% success rate.